Thanks for putting this program together. The healthcare continues to be a remarkably politically charged issue, but it really shouldn't be. If you think about the implications for people, you think about the implications for budgets and all these other important issues that we have to deal with. The one thing I would say to John's last comment about Medicaid expansion is I do think that it will become increasingly difficult for states to continue to hold out because there is significant fiscal incentive going forward to take the Medicaid expansion. And so even though we haven't seen movement in the short term, I do tend to think that more and more states that have not been part of the Medicaid expansion are going to be very tempted to come in. But again, we come back to politics. And so I would hope we can make some productive headway over the next few months. But unfortunately, I'm not overly optimistic that that's going to happen.
Great, thanks. And John, perhaps you next?
I guess I'd just like to note two things quickly. One is it's really to thank the Trump administration and the Republican leaders in Congress for putting this issue on the table, because there's a saying, what doesn't kill you makes you stronger. And the ACA has probably never had more public confidence and more understanding and acceptance. Look at the Jimmy Kimmel example than what we've seen over the past. I mean, people who didn't really understand pre-existing conditions, people had no idea what an essential health benefit was. And now there is just incredible understanding, and the resilience of people all over the country through the Indivisible movement and through the other grassroots organizations who have just stood up to defend what has been gained has just been extraordinary.
Bob?
Well, I disagree. I don't think that Jimmy Kimmel is the standard for health policy analysis for America. But I would say this, that we've learned a lot, but it is we keep talking about how we're debating healthcare. Actually, we're not debating healthcare. If we were debating healthcare, we would be debating things like diet, exercise, nutrition, all of those things which actually contribute to health. What we're actually engaged in here is a political science debate. And that political science debate is ultimately who makes the decisions in the system about the key healthcare decisions that you are that affect your life. At the end of the day, that's really it. It's going to be a question about whether, in fact, you're going to have government officials make determinations about what kind of plan you get, what kind of benefits you get, what kind of medical procedures and treatments that are available to you, or whether, in fact, you will be able to exercise control, not only over the decisions, but also the dollars to enforce those decisions. Frankly, we've got a long way to go. This debate is not going to end, I think, over the next 2 years or the next 4 years. This is a process, basically. It's not an event. No single legislative action is going to end this debate. But I think there are some very, very major decisions that this country is going to have to make. We've got an aging population. We've got very, very serious demands on us. And we have to make sure that we use the best resources that we have, both public and private, to get the best value for our healthcare dollars. We're not doing that now. And that, frankly, it seems to me, is the major objective of public policy going forward.
Thank you. Sheila?
I think Bob's correct. This debate is not over. I think many of the issues Bob raises are legitimate issues that need to be dealt with in terms of the role of government and the relationship in the healthcare system. But my concern at the moment is the current stabilization issues that we need to deal with in the very short run that allow us to continue that conversation, allow us to talk about value, allow us to talk about essentially the relationship between individuals and states and the federal government. But I think we need to do that in an environment where people aren't fearful of losing their coverage in the near term.
Bob?
So my apologies again. The overall settlement of where we're going will actually turn out in the 2020 election. And President Trump will run as the most polarizing president probably in a century. The reason why we can't reach agreement is that people in politics are not sure who's going to show up, how intense they're going to be, what they're going to want. And so one is pictures of thousands of angry young people who never voted getting even. The other is rural people in pickup trucks turning out like they never did before. When that election's over, you're going to look at that and people are going to say, let's reach some agreement here and move on. But until that is over, we are stuck that people who are looking at politics cannot figure out with this polarization, from the White House in politics is going to mean. And that doesn't lend itself to big, broad, sweeping settlements if you're not sure what that day after November is. After that, I really think the next panels after that will all be on policy. We will not be who is running where. For it. But till then, we are really stuck in what is this event in American history going to mean for the future.